Good morning. I have no idea what time it is, but I do have something to say. This is Elise. And guess what? Normally I have my studs in my ear, but I don't have them this morning. Does it matter? No, because what I have to say is most important, above and beyond a pair of studs. So I got on this shawl right here and my PA hat because it's cold. It really is cold in here. And I closed one of the windows. And somebody said, well, it would be cold if you have all your windows open. So why did you have all your windows open? I had all of my windows open because there was a kind of gas leak in here earlier this morning and then the night before. And, when we call send HUD, they always tell us that they don't smell anything. And they say, oh, well, it must be coming from the outside. But I have my own thoughts about that, but it's not important right now. The most important thing is the way that I combat or had to combat the problem by opening up all of my windows in the front area. So you see back there this big, huge bay window. I have two sliding sides. So I open those, and then I have another one in the kitchen area, and then actually in the other area, bedroom type, there's a window there too. So that one was open as well. Anyway, let's talk about medical mishaps. Medical mishaps, the psychology behind medical mishaps. Now, somebody said, well, wait a minute. Why would there be a psychology behind medical mishaps? Sometimes when there's a mishap, it's because a doctor just made a mistake. Well, what if you find out that the mistake was intended or planned? And then it looks like if a person reports it, that they are the one who is really crazy. That's if it is caught. If it is caught. But then again, truth always comes to light at some point. It does. It depends upon time and it depends upon circumstance. So if you're in the stance of, you know what, I know for a fact, or I am convinced, I am certain, and you hold, regardless to what comes your way, what leaves, what you hear, what you see, because sometimes what you see is not always what is cracked up to be. At some point, there will be truth. So, some years ago, around 2003, I myself was in the emergency room and then in intensive care at Albert Einstein Hospital. My pressure was sky high. And what some people didn't know was that during that time I was at home experiencing sewage water flood in my apartment. And this was with NYCHA. And the stench was so bad. It was disgusting. And everything in my kitchen closet, which meant my clothes, my boots, other shoes or whatever. I also had some supplies that were connected to the business that I ran. I had my pictures for my album project, the negatives, also some of the developed pictures, a lot. They just got destroyed. And my furniture at the bottom was soaked with sewage water because the flooding went from the kitchen all the way to the back of the apartment. So somebody might say, well, how come you didn't leave? Well, you know what I did? I worked at the church. And the church was the Lord's Church Family Worship Center on 180th Street at that time and 3rd Avenue. So I worked there, and we had the summer camp, we had the leadership program, we had the after school program, and these things were running strong. And I myself driving the van, not only that, putting the programs together. A couple of other people, Tracy Skinner, the leadership program with me, and then the summer camp had some workers. Yeah, Sherry Days, Michelle Days, Phyllis Darden. I can't remember whom else, but a few of the kids and so forth. Then also the after school program. As I said, driving the van, myself picking up the children from their local schools throughout the Bronx, wherever they were, if they were part of the after school program, picking them up and bringing them all the way back to the church so that their parents could pick them up later after they got off work. Also with the summer camp, getting up like 5:30 in the morning and going all the way to Manhattan and then back to the Bronx and picking up kids from Queens and over there at the Hugh Grant Circle. That was like the meeting place and so forth. And then picking them up from other areas throughout the Bronx and bringing them back to the church. I was the only authorized driver at the time. And then coming back and running the program, taking part in everything, with the kids and so forth, a lot. And, you don't always come in and just tell everybody what's going on with you at home. And so I was experiencing this flood. And my house was newspapered up. It was disgusting. And I managed to get like 22 pictures together, and I stapled them to a board. And I hand delivered them to NYCHA. I also believe that I filled out a notice of claim. I think I took it down to NYCHA as well in person. Also mailed everything, to them so that I could have proof and so forth. I put together a file or dossier with exhibits for everything that had happened to me with regard to this apartment flooding fiasco. Now, let me just tell you that there was a company called KB, I think it was, that was contracted to remove asbestos. And this company had a representative that came in, and he actually tore out the wall in the kitchen and busted a pipe. So that's how the flooding came about. So in my journey with this mess, I am like, I can't stay in here. So of course I'm working at the church. So I'm just continuing to go to the job and also communicating with the development, and saying to the development manager, I think her name was Miss Taylor at the time, that I would really like to transfer or be moved until this gets cleaned up or whatever. And they tend to think that, or they tend to qualify situations in a very strange way. I mean, even if it's not something that, the tenant or resident did, it's still looked at as like what? So you might call or put in a ticket for the complaint and you get a date somewhere next year to get it cleaned up. And that is not good. It's not good at all. So anyway, jumping to the chase at the end, the Cleanup did not actually happen until months later. But between there, I ended up in the hospital at Albert Einstein. And my pressure again was just sky high. And when I left out of the hospital, being discharged, I was on 8 medications and a patch. And I think the doctor's name was Martin or something. And as I walked down the block, I couldn't walk for like 2 blocks. My blood pressure, I found out, was so low. I would walk 2 blocks and go and just be so tired. I'm like, what is going on? And this lady from my church, I ran into her one day, and she actually recommended to me a Dr. Donald C. Wallerson. And he was a board certified cardiologist. So I went to him, and I ended up being a patient of Dr. Wallerson's for 14 years. So it's not like I had not stayed for the long haul. When I met him, I was excited that he was, a doctor of color and a young man and with a practice. I was like, wow, this is so great. The kind of mentor, perhaps, or potential mentor, perhaps, for people and children and so forth. So, my whole thing in life, I've put together different events at shelters and just events bringing information to the public, and senior events and wellness events, for people with dementia, or hooking up with other people who have organizations that, are geared toward or focused on, these types of things, and working together, collaborating, and then also bringing some of my own stuff, which one of them was the New Dawn Foundation, which was, what is her name? Oh my God. Zorema Jagagoven. I can't pronounce it well right now, but excuse me. Anyway, she's well known. And Anton Barusha. And great times at the New Dawn Foundation. And so with that, thinking about Dr. Wallerson and being his patient over time, I asked him if he would do something for me in Manhattan for a daycare, giving like this heart talk, heart matters, so that the kids could get an understanding of how important it is to take care of the heart. And he came down in his, I want to say 1977, 1978, pale yellow Mercedes-Benz Classic, and he did the talk. And I was like, wow, I was blown away. It was so beautiful. And one of the staff members, for the summer camp and I think after school program, maybe, Michelle Days. I'm sorry, Michelle Days Brandon. She was the director of the center down there in Harlem, which was where the event took place, at the community center. And they had like a kind of like a daycare program over there. And that's exactly where everything happened. And again, it was really beautiful. I was there. It was beautiful. And first of all, you never put something together and not show up. Not unless you absolutely can't make it. So, at any rate, being a patient of Dr. Wallerson's, a patient for some 14 years. And never, ever a problem. Never a problem at all. And I remember, the first day that I met with him, and he said to me, Lisa, I said, well, he said, reduce, because I was heavy, but I've always taken very, very good care of my body. And my pressure was the issue, not so much that I had a heart problem. My pressure which was stroke level at the time that I was admitted into Albert Einstein. And then being in there for a while and then coming down to a medical floor. And then after that being released and so forth. But back into the same mess at NYCHA. Ugh. I mean, that's enough to drive anybody crazy. Could you imagine? I believe that was in August. And then the cleanup did not take place until like somewhere toward the end of the year. And then what happened in between there with it? Oh my God, the lights, the bathroom, the all this going on. I mean, they came with a wet vac, and they did some stuff, but stuff still kept happening. So in other words, it just, there were other ramifications, and it was the stench. The stench was horrible. And imagine my furniture, all the bottom, just saturated with that soup. What do you do when you can't like go buy a whole nother living room set? What do you do when your boots, your shoes, your fur coat, all your stuff is just disgusting? I mean, ugh. What do you do when all of your food spoils in your refrigerator like 3 or 4 times? What do you do when the lights keep going out and you're calling? And what do you do when the water is dripping down on the electrical in the back of the wall? What do you do when your bathroom wall is disintegrating right before you behind the toilet and you start getting mice and stuff coming into your house because the mice are large behind the wall? What do you do when they take off the sink and they take off the toilet and put it inside your tub and you don't have a place to wash in your bathroom? What do you do when you have to go and bathe inside of your kitchen, the place where you cook your food? What do you do when the kitchen sink becomes so just so just stopped up, but you don't now have a kitchen sink and you don't have a bathroom? What do you do when you have to go to the bathroom? What do you do when the only thing you can do is get a wash pail for a mop and take a black plastic bag, crap in it and pee in it and throw it out? Get down. That's my cat over there. What do you do? That's enough to make anybody go bonkers. But you keep going to the best of your ability. So even while I was in the hospital, I had a Dr. May, and I said to her, Dr. May, I can't go back home to this. Could you help me out? I can't. It's just terrible. I can't go back home to this. And I think she thought that I was crazy. Like this stuff wasn't really happening, but it's documented. Totally documented. And you know what? To date, it's gone on from way back then all the way through. Same stuff over and over and over and over and over and over again. So here we are from 2003 to 2017, a patient of Dr. Hollison's. So never ever, like I said, a hitch or glitch until I believe one day I came in and I was in tears. Not when I walked in the room, but just as I sat when they called me, I just thought about some things and I just started to cry. And I can't recall what the doctor's name was, because anytime you go to Dr. Wallace and you wait for a substantial amount of time and you'll see a different doctor first. Dr. Sandor, Dr. Joseph, Dr. Liverpool, Dr. I don't know her name, Jimenez or something like that. Well, those are the ones I came in contact with before I would see Dr. Wallison. And you would get the heart exam, the echo, the this, the whatever, from one of the other staff members, medical staff members running the tests and so forth. Then you would see Dr. Wallison after everything for maybe about 5 minutes or 6 minutes, depending. So at any rate, I cried this day because I had lost like so much weight and I did not know why I lost the weight. And imagine on the very first day in 2003, I believe it was August or September, he said to me, Lisa, reduce, reduce. And then here we are all these years later, which was 2000, I want to say 17 or 16 around, I think 17. I had lost this weight. I think it was 16 first. And he never noted it. He didn't note it. And I was like puzzled. Like, how do you not note that I lost all this weight or 17 things? How do you note how do you not note the weight loss? How do you not note this weight loss? And I was a regular. I mean, I wasn't a patient that was just in and out. You know what I'm saying? And I mean, in other words, I'm here and then you don't know anything and just haphazardly. And no, I was up on things. And if ever there was an issue, I would always call ahead of time, or even in my travels, I would be like, okay, I'm just down the block, or because I regard people's time, you know what I'm saying, as very important, and I regard people's, professionalism, you know, regardless of what field that they're in, I try, to the best of my ability. So I never ever had really an issue there, and then I think one time before, well, there were a couple of other things that happened as well, but I don't have to go into all that because those also were mishaps. But this one was just in particular ridiculous that the weight loss was not noted. And then I ended up having to leave my job, which he filled out some papers, so that there could be the leave and so forth. And I applied for, workers' comp and the whole nine. And I'm still fighting. I'm actually still fighting. And, with that, I asked for some progress notes. There we go. And the progress notes I was told I could not have because a lawyer or my lawyer would have to, send for them, pay for them and get them. And my lawyers were telling me, no, they're your notes. You should be able to go and say, could I have progress notes? So one day I came into the office, and after 3 weeks of asking for notes and being told no by Dr. Wallace's staff, he comes in. I mean, he comes to me. He goes, oh, here. And I said, what is that? Oh, your progress notes. Really? I'm like, oh, okay, thanks. And he goes, well, they were always available. What? Always available? Okay. I'm just like, all right, but I'm just grateful. So I get the notes, and I actually had, started to go to Mount Sinai Hospital, I believe it was. And I had the notes scanned into the system. And I actually didn't read them too tough because I trusted my doctor. I did. I trusted my doctor, And I mean, if I skimmed over them, I just skimmed a little bit. And I don't think I really even saw how they were actually constructed at the time. Or put it this way, I could be wrong. It's been a number of years. I saw it, not immediately, but I saw it. And I went back to Dr. Wallison with questions. Like, what is this? What is this? He made some specific comments and allegations that were never discussed with me. And then the second thing is, some of them didn't even relate to my connection with him as him being my provider. So how could he comment on something that we never discussed? And saying that these things were established. Where did you get it from? Established how and by whom and when and why? And one of the things I'll tell you he said was chronic renal failure. Never heard that in all of the years, chronic renal failure. So it was handwritten in, and I think there was another printed, notation. And when I asked him, like, what is this chronic renal failure. And he goes, oh, it was a computer glitch. I said, a computer glitch? And I know it sounds crazy to you, but to me, this is a true medical mishap. And if it was such the computer glitch, why would you hand over to me these things that you call progress notes that you put together with regard to my connection with you, Dr. Wallison, as your patient? I mean, is that a psychological game or a manipulative game like none other? Are you kidding me that you put it in my hand? And that's exactly what he did. He put it in my hand and, oh, don't give these to anyone. I just chuckled. But imagine that I asked him about that in June of 2017, but then also asking him for a follow-up meeting because I needed to understand more about why did you do this? And then to address some of the other issues or some of the other, established points that he put in this note that had nothing to do with our relationship as patient to provider and provider to patient, especially because they were never mentioned. And then where did the information come from? So going back to that time that I cried, he used to have an assistant. I think her name was Amy. And yes, I was crying because he did not note in the file the change of weight, but always took my weight. So why wasn't it noted in these? And then I realized, oh my God, what kind of progress notes are these? They jump from April to May, and then they went from November to December. So what happened all in between there? Just the crazies. And I was asked, well, why are you crying? And it wasn't like I was boo-hooing or out of control or anything. I said, well, I lost all this weight and I don't know why I don't. And it kind of just puzzled me. Have you ever been in a state where you're puzzled about something because you take care of yourself well, and all of a sudden, you were 239 pounds and now you're like 16 or 18 pounds down, and then later on, you're more than that, you're down to like 168. And then not that long ago, I was down to 145. And then the weight was fluctuating and still unexplained weight loss. So now I'm down another 13 pounds. I was up 187, but now back down 13 or 14 pounds. And that's just a little share. But here's the thing. When you have somebody that's keeping up with you, who's supposed to be, or looked upon as your provider, these things are supposed to be noted. So why wasn't it noted? But why was all these other things never spoken of before so noted in a progress report, hand delivered to me after 3 weeks of being told I couldn't get them? And they were just ridiculous. And then when I looked at the names, Lisa Reynolds, Ray, just the spellings were crazy. Lisa Gill Reynolds. But every time I went there, I would be like, my name is Lisa Reynolds Gill. So like what? I mean, is this a mishap or what? Why is it that this is not corrected? And I'm telling you what I did. But I'm like, okay. So these are some of the things that, I've gone through. And then the latest thing is my applying for, a particular insurance. And he notes in the note, because they'll send out fielders to find out what's going on with the patient, the insurance company, to determine, whether or not the potential insurance claimant will qualify for the insurance. So I specifically did not qualify because of something that Dr. Wallison put in the notes. And it is not a fake and a phony. And, when they told me about it, and the insurance company has to let you know. And I mean, to say that I have like a history of this and a history of that, I'm like, where did all that come from? I never even heard that before, and not in my file that I know of. And you know what? My question would be why? Why would he do this? And that history given actually might have been the history of someone else, but How does a doctor make a mistake like that? How does a doctor make a mistake? A medical mishap, the psychology behind medical mishap, and not check and verify with all the stuff going on. How could you release something like that? Then I started to look at some of the bills, that were sent in to my insurance company. And some of the same stuff that was inside of the progress notes were billed for, but never discussed with me and never told to me. So my reason for going to Mount Sinai right after that June 2017 was to make sure that I get testing all over again that could absolutely refute what it was that Dr. Wallison was putting in these notes. And they still refute. But then there's been some crazy things going along at the same time. And you know what? Some things for some people could be made to look like you're one way and you know that you're not. And the reason why I say that is because some people seem to think, or people seem to think, that if a person can't prove something, or they just have this stance of they'll never be able to prove it, because of whatever professional, how do you say it, connections that they may have, or whatever, it tends to lean towards their side of being supported for what they say rather than the other person having any support at all. But I'm here to tell you, if you're convinced, if you stand flat-footed and you stand for truth, it will come. You will see the light of truth. So, people never want to divulge, information about a doctor, about this. And my take on it is, you know what? I personally have no choice, especially if it's affected me in some kind of way. And then you want to know something? People will look at you and they could think all kinds of things, but if they never really get to know you, come on, then what? So did he think that I was a homeless person? Did he think that I was somebody that didn't go to school? Did he think that I was somebody that was cheating the system? What did he think? Did he think that I wasn't worth it? Did he think that I should not get workers' comp? Did he what was it? That all these things were so established in these progress notes that I fought for 3 weeks to get. Not literally duked it out, but just talking to Miss Helen, telling me that the attorneys had to get them, and being told by the attorneys that they're your notes, you should be able to get them, it shouldn't be a problem. And then going to a new doctor. Shouldn't have had a problem scanning them in because I trusted the doctor that I was with for that time of 2003 to 2017, 14 years without a hitch or a glitch. One time with a cry, and then one time, I'm also a medical person, but he didn't know that. He didn't even know my background, but I would say to him, like, look, I'm part of the scholarship committee, and would you like to donate to our scholarship committee for one of our recipients of our scholarship award, blah, blah, blah. And Dr. Wallison gave $50 a check. And then one time, $50 toward food that we were doing for shelter. And I mean, he was beautiful. He supported the efforts. And the efforts were not fake and phony because we just don't roll like that. Always doing that kind of, charitable work and work with people and shelters and children for years and years and years. But as far as my background and my schooling or what's been going on with me in my life, he didn't know that. We didn't have that kind of, talk or relationship, but it did not mean, like, get this, it did not mean that I wasn't a professional. And maybe at the time, over the time span, we didn't get to talk a lot about certain things, but we weren't there for that. We were there for the medical. But when I went, I always was reading a magazine, reading a book, or crocheting because I love to crochet. And then some patients I would have conversations with, they would be so beautiful, and we'd exchange numbers, but never a hitch or a glitch about anything. One day, one of the workers was standing there talking about something that was personal. And I made mention, I was like, I don't think this is the place for that. I mean, not to her, but to her superior. And that's just, the professional side of me. That's the counselor side of me. That's the business owner side of me. I didn't tell him that I own companies or and such. And here we are today. He can look at it and he can say, that's him, Dr. Wallace. And well, she's just a wannabe. She's just trying to. No, honey. Since 1984, on record 1985, legally through my attorney. That's right. And forward. And also, might I add, I write poems, I write articles, I write stories. I started a couple of magazines. I mocked them up myself, and I gave a couple of my articles, poem and articles, to Dr. Wallace, and just to look at. And he thought they were beautiful. One of them was Somehow I Know, and I think I gave him Balance in the Midst of Tragedy or something. And later on, over the years, he would say, "Are you still writing?" And I said, "Yeah, I am." And it's crazy how people will think other things than what it is that you're telling them. And then when you have a notation put in a progress report, anxiety established, well, can you now see why they might think other of you than what you really are? But we never had any conversation or communication in terms of anything outside of the medical. So what was it that he thought? That I really didn't write? That I really didn't do the charitable works, the shelter works and all that? That I was just a fake and phony and just trying to get money out of him? Or what did he think? That I really didn't go to school? And when I graduated with my master's degree, I told him, I said, I got my master's degree, blah, blah, blah. Ooh, that's beautiful. And okay. And that was cool, because I actually, held him in high regard. But there were several things that happened within the framework of 14 years. And I could say maybe 3 or 4 things that were like stand outish. And even when I confronted with one of them, I was told that the lab had a problem. So I said, well, okay, if the lab has a problem, the next time I come, could we get the report? And to date, I never got it. So I have to talk about the psychology behind medical mishaps because it's real. It is real. And then when you think about providers billing for stuff that is not even related, or if it is something out of the span, or the scope of what has been discussed. So how is it that you can make a diagnosis, and then not tell the patient? I mean, like, really? Not tell the patient? That is crazy. And then when you're confronting the doctor with it, they just act like you are in La La Land somewhere. Well, let me tell you, we are not a mental case. And check this, even if you've been in a situation where you've experienced a traumatic experience, or, a stress and all kinds of stuff going on, and you've never had any kind of diagnosis of being mentally ill or mentally challenged, life can do it to you. Life can really just mess you up, and it doesn't necessarily mean that you're mental. But this is a physical response to a present happening, or a physical response to a past happening. It could be a combination of happenings. Okay, so you have the past, you have the present, and then it's like, oh my God, what will be? And when you drop a whole bunch of weight like that in such short time, 2 months, 50 something pounds, I mean, does it warrant tears sometimes? It does. And then you're with people that you think, like your providers, you think that they are, sensitive with empathy and the whole nine, because you've trusted your life in their hands, your care in their hands. But to respond so blatantly the opposite of what it is that you've known over the years, what a mishap. What a mishap. So this last thing, which was just about a year and a half ago or so, it could not have been a mistake. But the question would be why? Why would that be? Why would this kind of response come from this doctor like this? And then in going back to a file that I saw with Social Security, like, because I went through a traumatic experience. I mean, so many different things. Oh my God, so many. You know, a mom, a husband, job, apartment. I mean, because remember I said the apartment situation was like ongoing. I mean, there was so much, and I'm one person, just like many of you. We're all one person at some point, right? But the way that things happen, it could be like we're two people because it's just so stressful. Well, listen, it happens. It really does. You never know how something, traumatic is going to play out, in its exhibition, in its showing, in the manifestation. You just never know. But then you have people that would jump on board immediately and try to call it something else that it really isn't, even though you were with them and they saw you for 14 years. And remember, not having that communique, that professional communique, to give them the idea that, oh, I'm actually where you are. We just have two different medical professions. I never ever told him that I was honored by Columbia, the diagnostic and teaching. He didn't know anything about that. And how could that be? I'm a person of color as well, but yes, it is true. A lot that he didn't know, but he didn't have to know. But should his treatment of me been have been any less or any more? Think about that for a moment. So if he knew that I was on a professional level, but I'm just cool, like the kids say, jiggy, like that, should his treatment have been any different? If I was more on the professional tip with him? I'm this, I'm that, I'm the other. I have my bachelor's, I have my master's, I have this, and maybe there was a down period. Does it take away from who I am? Professionally or not professionally, does it take away? Medical mishaps. Did he already have a judgment about me when I walked through the door in 2003? What was the judgment? And then through the years, I'm sitting there crocheting and waiting an hour, waiting 2 hours, waiting 3 hours, and then I get a call every now and then that after the 2 or 3 hours, he can't see me because he had a medical emergency. But I'm like, okay, no problem. And I swallow it and keep on going because I have that much trust and faith in this doctor. And I understand that things do happen. But then only to find out later on, medical mishaps, the psychology behind medical mishaps, that he would do the absolute worst. So then we think about code of ethics. We think about informed consent. We think about all these different things that we all in the medical profession and in other counseling and other professions have to adhere to in order for our practices and our things that we're involved in with people, places and things to be legit. So where did all that go? It was just thrown out the window. So what was the judgment call and why did it happen? Some of it I know, and some of it is still a little bit fuzzy, but it does not necessarily mean at all that it will not be addressed in the manner proper. And I said manner proper. that he would have to answer in a court of law. The psychology behind medical mishaps. Come on, think about that. So where was his mind in all of that? Especially if I'm one who came, and I came also with a neutral party. Because sometimes when you're doing things like this, when you're addressing issues, and you need to bring somebody, because it would be you against the whole profession. So you bring somebody in as a neutral party, and there was so much drama with that, as well. I don't have to go into the whole thing, but will somebody tend to believe a doctor over a patient? Will somebody tend to believe a director or supervisor of a program that you worked for rather than believe your testimony about something? And you see, when stories are concocted, the question would be, why would they be concocted? Because maybe there's a dollar amount attached to it. Maybe there has to be some responsibility in terms of compensation for stuff that came on or was a ramification of everything that happened. And rather than these people come forthwith with the truth, they don't want to pay you. They don't want to compensate you. They don't want to do what's right. And they will use even your physicians. They will use other people, or they will get everybody on the bandwagon. This is what can happen, literally. Just to make you, the patient, look like you're other than what you know yourself to be. And we don't always have to walk into the doctor's office. Well, you know what? I am a graduate of this, and I have my degree, and I have done this, and we don't have to. Well, but then here's the thing. What if we did that? Would their take or spin on us be totally different? Would it have been where they said anxiety established? Or would it be personality disorder established from the onset? Something to look at, right? And then is it fair to say that just because you've gone through something traumatic, that it was out of something else other than what you said it was, and that they would use it against you, and then try to say that you have a history of this, a history of that? Stop for a moment. Hold it. But then here's the other part of it. Physicians have access to your medical records. And in trying to keep things to me at bay, with my connection to this doctor, anytime that I would be someplace and they're asking me to fill out, to allow my medical information to go here or there, I would specifically say, I do not want my information to go to this place. I do not want my information over here. I do not, and I would ask questions all the time. I would never go into all the details because I have that right if I don't want it to go here. I am literally separating myself after finding out some things, separating myself from this physician. And then even those who are connected, there's like the code of the blue or the code of the stethoscope. But then you have to boil it down to this. So if there's the code of the stethoscope, how is it that anybody can trust you, the extended practitioners of the one who took care of me? How could we trust you if you're rolling in the same vein that he is just because y'all are stethoscope buddies? Where is the code of ethics? Did you take the oath? Or is your oath to the doctor, to your comrade, rather than to the profession that you claim to uphold for the well-being and betterment of the patients and people that you see. It's all over. Medical mishaps. The psychology behind medical mishaps. I saw something the other day and I was like, what? Something another doctor put in as a bill. And when I saw it, I said, I didn't go to him for that. Where did that come from? I just saw it. And I had to scream from the inside out. We have to be careful. And you know, it's a sad thing when you look at somebody and you're like, from the beginning, like, it's like, wow, this is so beautiful. Such a, wow, I'm so excited and so happy and so proud. But what would not a person do? And then let's flip it. What would a person do? So, Helen, Valerie, Bruni, Cheryl, Kim, and there are a host of others that were there. And of course, Dr. Wallison. Of course, Mr. and Mrs. Hogarth. And a few more. Dr. Liverpool, Dr. Joseph, Dr. Sandor, Dr. Jimenez, I think. Wow. Overall, let me give thanks to the one. Many times we sweep things under the rug. And when it comes to our well-being, we can't do that. Sometimes we're afraid. Many could be afraid, or we can't do that. We should try either to talk to someone else or express it or whatever, because it's about our well-being. And if a provider is not doing the right thing, he has to be called on that board certified carpet. He has to be called to it. And that's the end of story. It has nothing to do with the stethoscope club. It has to do with right and wrong and the oath that was taken to serve and to serve well. And anytime that is out of hand, then they need to sit down. And it's just unfortunate that because sometimes we are judged, people can make decisions, or they do make decisions that are so out of touch and out of time, judging for the moment. But then even as you go along, 14 years, the judgment never changes, even though they might on the inside know. Did you hear that? But they already established something. So they're more acclimated to the lie than to bringing truth. And what happens when you say to them, please tell the truth? It remains to be seen. So for me, I see it. And I see beyond what I see. Medical mishaps. The psychology behind medical mishaps. Oh, is it that he wanted to break into another medical field? Interesting question. This is Elise signing out.